Anti-aging creams and potions make up a multi-billion-dollar industry. With our aging population, the demand for these products will only increase. We all know it's important to keep dry skin protected, particularly from the sun. But if you really want to slow down the effects of aging inside and out, you need to start with the knowledge of what to put in your body. Today we're discussing how to develop an age-resistant body, including your skin. Joining me is Dr. James Meschino, who belongs to the Academy of Anti-Aging Research. He's also an associate professor at the Canadian Memorial Chiropractic College, and he's an expert in nutrition. He has authored the books, Meschino's Optimal Living Program, 7 Steps to a Healthy, Fit, Age-Resistant Body, and the Wrinkle-Free Zone. If you have any questions, give us a call at any time. James, thanks for joining me today.
It's a pleasure to be here, as always. Thank you.
Now, let's face it, the population is aging. I think more than ever, people are concerned about what to put in their body and as well how to stay looking healthy and, well, young in this society of ours that really emphasizes the youth factor.
Well, there's a growing interest in this subject because, baby boomers and young seniors are highly educated and are seeing from the evidence in TV shows like this and books they're reading and radio interviews that there are proactive steps that you can take to slow down the rate at which you age, and as you do that also reduce your risk of some degenerative diseases from arthritis to dementia, heart failure, osteoporosis, and certain types of cancer even. And so individuals are seeking the right information about, okay, what are the things I have control of in my life that maybe my doctor is not up on to the degree that they should be with respect to diet, exercise, what dietary supplements should I take, what things could I put on my skin to help slow down the rate at which my body ages so I look better on the outside as well as feeling healthier on the inside. So all those things come together, and because there's such a demand for it, speakers like myself are in demand to deliver the message, actually.
Tell us about the anti-aging research organization that you belong to.
The American Academy of Anti-Aging Research was formed by a group of very progressively minded medical doctors in the United States who use the kinds of interventions that I talk about in my books to help their patients slow the aging process, actually reverse certain aspects of aging on the inside of the body and on the outside with some very cutting-edge things, but a lot of it, the main pillars, of course, are diet, the right exercise that's specific to the individual, and specific dietary supplements, the right formulations introduced at exactly the right time in the person's time table of life or their life cycle. And some other cutting-edge things that some of these medical practitioners do. Because of my background, having a master's degree in science and having done a lot of lecturing and produced a lot of research papers, they allowed me to go through their fellowship programs. So I'm part of that academy, and it's been a great experience for me.
Now, I think what you said earlier about reversing the process really captures people's attention. Many people are of the belief once the damage is done, it's done. But not so, from what you're saying.
That's not true at all. There are many aspects of biological aging that can be reversed. I mean, for instance, as men and women get older, we know there are certain hormonal declines that occur that are programmed into us. And with that comes, for instance, a decrease in our muscle mass and strength, and we get a little more frail, and our tissues start to sag, and we gain body fat because our metabolism slows down. And we lose calcium from our bones, so we lose some bone mass that can lead to osteoporosis. You say, well, that's just the aging process, there's nothing I can do, which is absolutely false. That no matter who you are or what age you're at, by using the right dietary approaches I talk about in the book and the right exercise program and the right supplementation interventions, you can gain muscle and lean mass and become stronger.
That's great news. You
can actually reverse some of the bone loss that's occurred, have more physical energy to do the things you like to do, elevate your metabolic rate so it goes faster, and shrink your body fat down. So with my patients over the years, and I have lots of examples of this happening, and I've done it with myself for a long time. So it's not a question of, well, is that really true or is that just some theory? We know that it's a fact, but people have to apply the appropriate strategies to make it happen. And so, what my seminars are about and what the books are about is to help people understand what are the nuts and bolts of that program, and Is it realistic? Can I do it in the everyday world that I know, or is it too difficult to do? If it's too difficult, don't even show it to me. And I'm saying it's not that difficult. You just have to do the right things consistently.
Now, I want to begin by discussing what not to do. First, let's focus on the typical North American diet, which, according to your book, basically promotes the aging process, the fast foods, the sweets.
Sure. Built into our genetic programming, of course, are aging genes. And so, we're designed to age over time and for our body to actually self-destruct and undergo decay and degeneration. But the reality is you can accelerate the process by having a very high animal fat diet. That's a big problem. Over-ingesting refined carbohydrates and sugars, and most people know that this is not an advantageous thing to do, and they fight with it. We all struggle with this to some degree. Not exercising on a regular basis or having enough physical activity for cardiovascular health to maintain your muscle strength and your bone mass. These are critical oversights that most people fall into because they get caught up. We get caught up with our day-to-day lives. There's a lot of things going on. So these things are relegated to secondary importance. But because they affect your health status and it accelerates aging and makes you more predisposed to heart attack and stroke and cancer and dementia and osteoporosis and compression fractures, when those things hit you, then all of a sudden all those other things that you were so busy doing, you can't do them anymore. Now the whole focus of your life is just staying alive and battling this health condition. And that's not a fun life. The quality of your life disappears or is tremendously compromised. So my point is, if you would just each day do the little things right, to focus on your health, because it's at the center of your existence.
Yes.
Without that, you lose the opportunity to do everything else you like to do. And you become a burden often to your own family. So when you do those little things right, and you have the health status that you're capable of achieving and maintaining, then, to me, your quality of life is significantly better. And that's, to me, the thing that drives me to be consistent.
Now, along with the anti-aging strategy that you discuss in your books, another byproduct is weight loss. And again, with age, many people put on a lot of weight.
We put on weight because we often become less active as we get older, Christine, as you know. People don't have the same energy. But you can get that energy back by doing certain things correctly. They say that a body at rest stays at rest. And Newton said that in physics.
Yes.
Likewise, once you get yourself into motion again, you start to get the healthy addiction from movement and activity. So if you ease your way in, having worked in a health club for many years where my practice was located, saw a lot of new members join the club, and they wanted to get going, and they wanted, the comprehensive program. And I said, no, I'm going to give you, this tiny little starter program. They go, well, I can do that. That's so easy, I can do that. I said, the idea is to start with something you absolutely know you can do every day. Go for a 15-minute walk every day. Well, I know I can do that. Well, then do it. Get started, and then it'll become 30 minutes, then 45 minutes, then you might start jogging half of it and walking there. Before you know it, you're in motion and you're getting the healthy addiction. You see the changes. Your body fat comes down. It changes your dietary habits. You tend to crave healthier foods when you are exercising. If you're a smoker, you tend to, at that point, say, now it's time for me to give up smoking. And what supplements should I be taking? So one small wellness step leads to the next in this continuum, and the payoff is huge.
You talk in your book about the proper kinds of fats, first of all. You mention a lot of nutrients, not only those, but the supplements as well. But I want to start dealing with a person's diet every day, how they could change it to one that, again, slows down the aging process. But we're going to do this after the break. Stay tuned.